Hema is the Director of Technology at Advocate with AI for Good at Intel. She's involved with Intel's Pandemic Response Technology Initiative to collaborate with customers and partners to address COVID-19's challenges. This is a really important effort, so thank you, Hema. She has passion for technology and for the role of AI in addressing issues in the healthcare and the life sciences sector. Welcome, Hema.
Thank you, Sukrita. Super. Hey, I'm really excited to be here to talk about this topic, responsible AI for healthcare. Before I talk about responsible AI, I want to go first into healthcare, and then I'll talk about AI for healthcare, and then I'll get to responsible AI for healthcare. So, as you know, all of us here as patients, as consumers of healthcare, this is something that we all understand very well. Our healthcare system is really not in a great shape. You know, as a nation, we spend the most, almost 20% of GDP on our healthcare system. But we have one of the largest sickness burdens. Like if you think about at least nearly 50% of our population has at least one chronic condition. And as we are, and also it's not, life expectancy also is lesser than Canada and Japan. So we are not doing that great. And as we age, and as population we are aging, and so as we age, it compounds the problem. And so what we end up is with more sickness and more cost. And one of the things also that is kind of not helping is the fact that we'll have shortage of clinicians. And this is, you know, so we'll have less people to help us take care of ourselves. And so this is the kind of the state of healthcare we are in when it comes to cost, access, and quality. Really, it's not looking good. And this is a file that I've used multiple times over the years. I just have to change the numbers, and it's not trending in the right direction. Because in reality, you know, we are in trouble, and in terms of the healthcare system, and we need help from many directions, and we need innovations and tools. And I'm very, very enthusiastic about AI because of some of these. And here are some examples where I can try to kind of explain, you know, why, you know, and how AI can help. When we think about healthcare, right, like just like every other sector, we are kind of collecting data, you know, the data tsunami. So we are actually, health is almost like 30% of the world's data is healthcare, and it's hard to kind of think about, okay, how much, if we have all this data, how much is really are we going to be using? It's actually 1 to 2% of the data is really being put to work. So and it's humanly impossible really to be looking at this tsunami of data and kind of make sense of it. And so in that sense, AI is like, you know, has made some real magic, especially in medical imaging and some of the areas where, you know, it has found all these hidden insights and hidden insights that's humanly not possible, actually. So that gets me all excited about, you know, we need some tools to think of it. You know, if we could really go after this 90+% of data that is today not being put to work, if we could look at it, how much more problems we could be solving. And so that gets me excited. And also the other example here I want to call out is, I talked about clinician shortage, right? This one is actually, as you look at developed nations, this problem is much, much more of a dire situation. Because if you think about kind of developing nations with a billion+ population and you know, less than 80,000 radiologists to kind of serve this population, right? And those numbers actually could be, official numbers could be much lower than that in China. And think about that. This is the problem. And then if you have like something like, imagine that AI can kind of look at all these cases and kind of say, you know what, 70% of these cases actually doesn't need to be looked at because they're normal, and then 30% should be actually be looked at by the physician because it needs attention, right? And so just imagine that, right? Now actually that is reality, because we have worked with some our customers and partners. Actually, in China, it's happening, and not for everything, but just for the lung nodule detection is kind of one of the problems that we were able to address. So, and there is no reason to think we cannot address other conditions also. And so that is one example. And the other one is about drug development. Drug development is really badly needs to be some kind of disruption, because you're talking about billions of dollars, and sometimes a decade for each drug, and only 10% of these drugs actually make it to the final. So we have this really tough problem, and already we are seeing how with the recent vaccines that we are seeing, we're already making progress, and AI is playing a big role in it already. And if you think about Moderna, one thing it feels like people may not have noticed it, but Moderna actually were able to kind of put out a booster vaccine for the latest COVID variants in less than 30 days. And that's kind of unheard of. And so that gets me really excited about, what all AI can do. And of course, in AI, I mean, if you ask people about AI for COVID, depending on who you ask, people may say, well, it didn't really, fulfill the promise. But I'm kind of on the other camp. I say, AI has actually played a role here, because we are seeing, firsthand with our own partners and customers. And I just put in a few examples here, looking from the left-hand side on the disinfecting robots to telehealth. And then I talked about medical imaging being like, one area where we have seen a lot of promise, especially when we had COVID testing shortage. Actually, a lot of the, the MRI and the X-ray, the tools were very helpful to kind of detect COVID. So, and then you have on the bottom section, you have the virtual ICUs. We had like ICUs to kind of complement to make sure that when the ICU beds were going low, there were some solutions there. And then there are more around genomic sequencing of these virus strains, and then AI repurposing, drug repurposing. This is an example where drugs that were created for a different purpose but kind of repurposed, dexamethasone and remdesivir, the one that President Trump took when he was sick, that was also kind of it involved some level of AI for drug repurposing. So if you ask somebody like me who's like a AI enthusiast, has AI been helpful and is it an important tool? My answer is 100% yes, right? And of course, we all, people who have been at AI, we've understood that, it has to be about, responsible AI. That's not something that we take lightly, but what has happened for us in the this year has been kind of a spotlight, right? The COVID has put a spotlight on really the disproportionate burden and the inequities in healthcare, right? That's kind of, that's come to light in a way that we are all forced to kind of, step back and kind of take a look. If you think about the 4.5 times the hospitalization rate, or the 2 times the mortality rate of Black versus white, that it's data that you cannot dispute, right? It is something that we have to. And everybody's sitting and thinking. The first question is, who's to blame, right? That's most of us aim to do. But the questions more than that is, where do we start? How do we fix? These are all questions that we're all asking. So when we think about, so we don't need to go to AI immediately, because that's one thing I would like to see, is that not people running towards AI as somehow being the problem. We should start with the system that has been in place and the processes that have been in place for nearly a century now. And I want to talk about that as a starting point. Now, before I say anything, I want to say that, our clinicians are the best. We need more of them. They are in this service to help us. So it's less about the clinicians. It's about, the tools that clinicians need as they look at, their patients to make decisions. They need tools. And let me see. Am I progressing? Yeah. So one of the I just pulled out a few of these risk scores that have been in use for a long time, and these are used by clinicians as they to kind of make decisions on diagnosis and referrals and so on. There's the AHA, the American Heart Association. There's a score and a study just as recent as 2019. There's a study that showed that there's the Black and Latinx patients with heart failure go to an emergency department in Boston. This is in 2019, and they were provided lower levels of care. And it was kind of attributed to some of the scores from AHA. And then there is another score called VABC, which is the VBAC. It's a vaginal birth after cesarean, and that score has been attributed to increased rates of cesarean sections for non-whites. And so I could go after each one of them. There's the EGFR for kidney failure. And so every disease category, there are so many scores that are kind of embedded in the system that are being used on a daily basis, right? And so the question then is, what are these scores? I mean, what's the basis of these scores? And it's not all very clear. I mean, clearly they were done for a reason, but it's not very clear. The assumptions are very invisible, and race is often used as a proxy to kind of explain the genetic differences, and unconsciously it has been propagating bias in the system. Now, one thing that I strongly and all of us, we believe that we look at the world based on our experiences. And so one example for all of us women here is that if I don't know if you experience this, but when women tend to go to the hospitals, they explain and talk about pain, then usually it's chalked out as something psychological usually, and that is not just something that happens once in a while. It happens routinely, and it is about something about a brave men and emotional women kind of a syndrome. So there are some things that are very kind of embedded, that kind of propagates physician bias without them knowing it, right? And so this is the kind of the system there is, and then it happens more for people from the underrepresented and minorities, right? It's like and so it requires all of us to kind of look and understand what they're experiencing in order to even understand AI, right? We have to understand the experience. And so, there is the previous documentary that I've started to look at, and here is a story of one lady. She goes for a gallbladder surgery, and then she is discharged, and then she complains of pain, and then she repeatedly said nothing is really at fault. And then when she collapses, she comes in it's known that she has a septic infection, and that which is really a hospital-acquired infection, which can be deadly. So that's just one example, and you really need to kind of understand and hear the experiences of people to really understand the level of fear, the level of distrust is in the system, right? And why does it matter? It matters because it translates to data that's in the system. If the you are so fearful that you don't show up to the healthcare system, then the data is missing. That's misrepresented, right? And so it's an incomplete picture, but it has other things that are based on bias and that are based on beliefs. And the additional thing we are seeing these days is the social determinants. These are things beyond just the clinical score, right? It talks about where do you live, how do you have access to healthcare, and a lot of these questions, which are called social determinants, is largely missing. I mean, we are working towards it, but so what we end up having is this incomplete data that is then being used to develop algorithms as input, right? Just imagine what happens with that. You have data that is incomplete, so it's garbage in, garbage out. And so there is one study that in 2019, this is highly publicized study that everybody, people with good intentions, tried to kind of build these algorithms and said, let's look at the data and say who is more sick, and so we can find out who should get the highest level of care. And it turns out that the white population were determined to be more sick, and obviously it did add up. And turned out that the algorithm was flawed in terms of the design, because it was looking at cost as a proxy to kind of say who are more sick. So it's a flawed design looking at incomplete data from a distress system, and obviously it leads only to flawed diagnosis and hence wrong outcomes. So AI is not where the problem starts, but it does do a few things. It reinforces or amplifies the bias and the power imbalances, right? And the people who develop the algorithms, I mean, it's hard to imagine that they understood the experience of the people for whom this will be used against, right? I mean, used towards. So there is the voices of the people who got the outcomes were not part of this. Their voices were not represented. So there is this, this power imbalance continues. It becomes this vicious cycle unless we stop and say, we really need to be kind of step carefully and see how we are developing AI. Are we developing AI responsibly? Is it equitable AI? Is it ethical AI? Is it based on trustworthy systems? So this is why I feel like responsible AI now is important, because as AI enthusiasts, right, we tend to kind of get all excited, including me. I mean, I'm one of those people who says that we cannot fix the healthcare system if we don't have things like AI, right? But I think it requires us to kind of take a step back and see how we should be thinking about responsible AI. And there are so many things. I mean, it requires an hour on its own, but I would say we should go back to saying design AI. The design element of it is like, let's start with asking the questions. Why are we developing this algorithm? Who is it going to impact? How is it going to impact? What are the intended consequences, or what are the unintended consequences? And and then how do we remedy it? And so these are the questions that we should start thinking about, and start with designing AI for good, and having a very comprehensive approach of the people, process, technology, systems, data, and algorithms. I mean, we have done some of this already, and this kind of approach, comprehensive approach, is something that we are used to, and we need to apply that to AI. Because as technologists, which I am one of them, we tend to kind of get all enthusiastic when we run towards AI. The questions we ask are, what's the speed, what's the accuracy, what's the sensitivity, what's the specificity, and the area under the curve. All of these questions are where people tend to, when they look at an algorithm, to say, is it like to measure the performance or the efficiency of it, right? But I think the question we need to kind of focus on is, how do we design AI for good? And there are many frameworks, but I've kind of looked at these different lenses through which we should be looking at. Data and algorithm is kind of very important, because it's about the data there. That's where it manifests. AI manifests. And we have to understand the data governance. Where is the data coming from? How is it going to be used? The security, the privacy, and so on. Those are all truly very important. But I would start at the beginning, at the people level, right? It has to be human-centered, the human agency, and it is about not just the developers who are developing it. It has to have the voices of a diverse community of social scientists, physicians, the patients, and even the developer voices should include all of us, like people who will have AI, algorithms used upon. We need to kind of develop the education pipeline, so that we can be part of those developer voices, right? And so there is a lot to be talked about here, but I would just say about the policy and the regulation. Those are two areas that we're kind of just starting out. I think we should pay more attention there, because we need accountability. and so on, right? So, but I having said all this, right, I still feel we have so much we can do together. We can lay this foundation for good, and and bring the best outcomes for all. So that's where I think I should be stopping. I'm getting a signal there, so I'm stopping there. Just saying that, healthcare, we are all in here for healthcare. It's not in a good state. AI can help, but we need responsible AI for ethical and equitable AI. And together we can do it.
Absolutely. Thank you so much, Haima. That was an excellent talk.